I became a doctor because I was idealistic and I wanted to provide good health care to the people in my community. The reason that I set up my practice in the community, a block and a half away from where I was brought up, was because I felt that that was the best way. The urban health plan came into being because I was no longer satisfied with being a private office. I wanted to reach more people. I wanted to increase the amount and the quality of services that we were giving the community.
As we sensed a need, that's how we built it, assuring that the human infrastructure, technological infrastructure is in place so that we have an efficient and an effective healthcare delivery system. Our facility is a beautiful one, as you can see as you walk through it. I think people, when they walk into a place that looks nice, looks welcoming, just start feeling better.
Urban Health Plan had invited me at a point where I was searching to grow more professionally. I was working in a hospital in New Jersey, and I needed a challenge. It was more that Urban Health Plan found me rather than I found Urban Health Plan.
I've had the opportunity to see organization grow, and I appreciate the fact that the Urban Health Plan has given me the opportunity to grow with them as well.
When I started in the organization, you don't feel that you're just pushed in and to just start seeing patients on your own and you don't have any assistance. If you have a question, there are many providers here that are willing to help you out, train you, answer questions, so you never feel like you're alone.
I started as a regular physician, and I got involved in different committees, such as the Joint Commission, the Performance Improvement Projects, and up to being the Associate Medical Director right now. We have to do it on a case-by-case basis.
I think the thing that's most important about working at Urban Health Plan and what makes it unique is we're constantly changing. We're constantly updating our technology. We're constantly updating the way we practice medicine to be at the cutting edge of what's the best practices out there. And that really makes it a fun, exciting place to work where you're constantly keeping up with the latest and newest things that are out there.
We were one of the first community health centers, probably in the country, who implemented an electronic health record. And we're very innovative in the things that we do. We try to use technology to help us improve the quality of care that the patients receive.
Not only do our patients have many health issues, but they also have a lot of social issues. And unless we're looking at the social issues and looking at the person as a whole, it's hard to really do the best thing for the patient. So in defining what a great doctor would be is someone who is really attuned and sensitive to all of the patient's needs and puts the patient and their families at the center of care.
At Urban Health Plan, I feel like I'm making a real difference. I tell my family and friends that I feel like I'm a small town doc in the most urban of areas. When I leave work, patients wave to me on the street. They tell me how their knee is doing. They tell me how their children are doing. They ask about my family.
Every single day that I see patients, at least a good 75% of those patients I already know by the face. I have patients from Staten Island, from Brooklyn, that they could go closest to them, but they come in.
We've always had an open door policy. When we were very small, it was easy. As we've grown, as we've gotten busier, we still have been able to maintain that as a vital ingredient of our culture.
The new breed of doctors, the younger doctors, would be the most satisfied because all of the reasons you dream about being a doctor, we fulfill them for him.